You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtina.com. On this episode of the Dr. Tina Show, I'm going solo, and I'm actually going to do an entire podcast on dermatology. I am answering your common skin questions. You know, the going joke is always with doctors whenever we're at parties or we're even on the internet. It happens all the time. People will send a picture of their rash and you know the joke, hey, can you take a look at this rash for me? So that's the world we live in. I actually have a pretty extensive dermatology knowledge, and while I am not a dermatologist, nor did I specialize in dermatology, I saw a lot of skin conditions and I have a knack for diagnosing and treating them. Turns out a lot of rashes are best treated through systemic therapies like naturopathic medicine offers. So getting the body optimized, getting the metabolism in check, getting the blood sugar under control, getting the hormones in balance, getting the gut taken care of. I'm going to go through some of these today, and this is inspired by my recent trip to Mexico. I met a wonderful woman down there in Sayulita, Mexico, who was from the UK, and she had a rash, and I was trying to help her with it. So my first instinct, I think, is correct on her diagnoses. But, you know, I took her through the gamut and I explained a lot of this to her, and I thought this would make an excellent podcast episode. So I'm going to explain this to you because we all deal with this, whether it's ourselves, our loved ones, our children. And when rashes hit, we don't know what to do. And we often run out and apply a bunch of creams, usually not in the right order, and can exacerbate or make things worse. We run to the dermatologist. They start taking chunks out of our skin to try to diagnose it. It's really just kind of barbaric, honestly. So I am hoping to bring some common sense to this lesson and teach you guys how to understand what's going on with your skin better. I'm not going to be talking about acne. I am not diagnosing, treating, or preventing anything. I'm simply sharing with you my experience after being in medicine for, at this point, we're going on 30 years between the time I spent working in hospitals, helping run clinics, to being in clinical practice myself. It's been a long, long time in clinics. I've spent basically up until a few years ago, my entire life in and out of clinics, either as a patient or as somebody who was working there as an employee or was obviously, you know, running my own clinic. I saw a lot of patients. I saw a lot of skin conditions when I was in clinical practice. And I'll tell you, most of them were not able to be resolved until we took care of the entire person. So your skin, I want you to think of it this way. Your skin is screaming at you through its rashes. It's letting you know something is wrong. What do I mean by this? Well, I'm going to get into the details of different types of rashes in just a minute, but I want to put this overlying thought into your head. If you are blood sugar imbalanced, meaning your blood sugars are through the roof, what do you think's going to happen? Bacteria and fungus love sugar, right? They're going to eat off of it. So that stuff comes out through your skin. If your blood sugar is out of whack, you're going to have, as I always talk about, this is metabolic health, you guys. This is metabolic dysfunction and metabolic health, which 88% of Americans are dealing with, US adults, I should say. And we have exported this problem worldwide. This is my belief, my opinion, why we are still in this ridiculous pandemic, aside from the vaccine campaign dropped into the middle of essentially a worldwide hot zone. But that's a story for another day. When you are in poor health or imbalanced, not only does the skin talk and share itself and as a problem, you know, red flag, problem. We have a problem inside. But infectious agents are more likely to glom on and cause problems. So I'm going to go through kind of my clinical thinking around dealing with dermatologic issues. And we're going to be troubleshooting skin issues, if you will. So the first thing I do, I can look at someone and tell you if it's systemic or if it's some sort of infectious agent like bacterial or fungal. Now, I know you guys can't do that. I've got that from just years of clinical experience. But I'm going to break it down so hopefully you guys can start to see what I'm seeing. Let's just first assume, just right off the bat, if you have a rash and you're like, what the heck is going on here? I want you to first look at where it is. All right. If it is on one side of your body and not the other, it's just isolated to one side, the simplest thing to do is assume bacterial or fungal infection. And if you apply, I usually go for an antifungal first, to be honest with you. Because in this day and age, with the rate of metabolic dysfunction that we have, if you've got a high blood sugar level, fungus loves that stuff. So fungus is going to glom on and it's going to present itself as a topical skin infection. Candida rashes are common. You see that in infants. You see that a lot in formula-fed infants, actually. And so applying an antifungal cream, a popular one you can find in the athlete's foot section. I'll give you a little pearl here. It's called clotrimazole, and that's just a popular, very safe, benign antifungal. It's sold in the vaginal health section of the grocery store or drugstore, and it's also sold in the foot section, the athlete's foot section. It's about 3 times more expensive, I found, in the athlete's foot section. You don't need brand name. You can just buy good old-fashioned clotrimazole. I found that one to be really broad spectrum. And again, I'm not giving you medical advice. I'm just telling you what I do. This is what I do for my family. I actually buy clotrimazole from Costco in the 3 or 4 pack, and then I just hand it out to family members because everybody, I believe, should have a tube of clotrimazole on hand. Because if a skin infection hits or some kind of skin lesion, I vote antifungal first. And I'll tell you why in a minute. We apply the antifungal first. Do we see any change? Usually you'll see a marked change pretty quickly if it's fungus. Okay, great. We've got a fungal infection. What do I do? Clean up the gut, clean up your diet, get some sunlight on it, get some exercise in. Something that I suffer with is because I have had such internal fungal issues through, you guys know my story of my poor health. Well, it still haunts me. Every so often it creeps up, rears its ugly head. And so I'll get a little skin lesion and it doesn't even look like anything. It just itches. And guess where it'll usually be? It's in the regions like the groin or the armpits or somewhere where I am sweaty. And maybe I worked out and I didn't take a shower, or maybe I saunaed and I didn't take a shower soon enough. When you sweat, you release toxins. So you need to go wash them off pretty quickly. And you certainly shouldn't do what I have been so known to do, is hang out in a sweaty workout bra or sweaty shorts, right? Or sweaty underpants. Get that stuff off, get it dried out, wash it good in hot water, and make sure you shower off. All right, so if the antifungal doesn't cut it, you can apply an antibacterial cream. So Neosporin is a common one, and they have generic forms of that as well. That's much cheaper. You can try an antibacterial. I have found clinically and personally that antifungals 9 times out of 10 work. The antibacterial sometimes can be you have an infection. If you have a bacterial infection, you usually know it's not a red, itchy thing. It's a sort of scaly, oozy thing. So bacterial infections look infected, and not always, but another thing you can do is you can take an antifungal cream and an antibacterial cream, mix them together and apply that. I would say, obviously seek counsel from your doctor. But this stuff is over the counter, so I feel safe to share it with you. 1 or 2 times a day, I would say, let me back up, probably 2 or 3 times a day, and see what happens. So I clinically think antifungal first, then antibacterial. The reason I do this separately and not together, now I might tell somebody to mix it together and try it that way, but the reason I don't personally or in my family is because I don't want to kill the flora. If we've got healthy bacterial flora there and we've got a fungal infection, if we kill off the healthy bacterial flora with an antibacterial cream along with the antifungal cream, we are letting potentially the fungus take superhold, right? It's kind of like when you weed your garden. Same thing happens in your gut. You take an antibiotic and you kill all the weeds in the gut. Well, some of the weeds we needed, and then if there's bad weeds there, bad bugs, and they didn't completely get killed off, they actually take over the yard. So we don't always want to hit it with an antibacterial. I try to keep that skin mantle intact and get the antifungal down. There are natural ways to do this as well. I think calendula ointment is wonderful, not as strong. And I'm using these topical and yes, probably toxic skin creams, but we're just covering usually hopefully a smaller lesion. So that's what I do first. The reason I don't go for hydrocortisone first, which commonly seems to happen, I don't know what it is. Often patients would come in and say, oh, I put hydrocortisone on it and it exploded. Well, I'll tell you why. Often if it is fungus or bacterial and you put a hydrocortisone cream on it, you're inhibiting the immune system with the hydrocortisone cream. That's entirely the point of it, is it shuts down your immune system in that little small region, or it calms it down so that if you have an immune-driven rash, which I'll get to in a minute, then sure, hydrocortisone is going to be helpful. But if you have an infectious rash and you put hydrocortisone on it, or an infectious agent rash, I should say, you just knock down the immune system. And so that infectious agent is going to go crazy. So I'm not a big fan of using hydrocortisone first. In fact, I suggest people use it last. So clinically, antifungal, antibacterial, hydrocortisone in that order. And you can get all of these over the counter. And if they don't cut it, but they're working, that's when I'd go to your doctor and maybe consider something stronger. I do find that sometimes a stronger, like a 2% hydrocortisone cream or stronger antibacterial ointment is needed. Oftentimes, I will say that the antifungal over-the-counters are just fine. So this is how you can help yourself and your family. And I know I'm a naturopathic doctor. So of course I'm doing, like I said, all the systemic things at the same time. I'm trying to improve their gut flora. I think bringing in a probiotic is really helpful. I carry a great one in my store called Megaspore Biotic. And I think that you definitely can use a probiotic to help here. Some people will say eat yogurt that has, not super adulterated yogurt. I like plain, full fat Greek yogurt. So we've got the flora in there. I mean, there's all kinds of different ways to go about this in a more natural way. And I'll leave that up to you because there's wonderful topical herbs. There's all kinds of things that we can do, and internal herbs as well. But that's not what this is about. This is more like troubleshooting your skin issues than it is treating your skin issues. Alrighty, so the next, I wanted to talk about some common fungal infections. That would be the next thing. So ringworm is really common, really, really common. I've seen it in adults, I've seen it in kids, I've seen it in dogs, and it's super common. People freak out about it. It is not as contagious as you think. In fact, I will say this, immunocompromised people get infections, as I mentioned earlier. So the only time I've ever gotten ringworm or gotten some kind of skin infection that was aggravating like that, I was in a super stressed out state. I was usually underweight, super stressed out, working too hard. So, and now it's not someone's fault necessarily. I got ringworm from borrowing some boxing gloves in a boxing course that I was taking. So you never know. That fungal agent might be in the gloves and it doesn't impact the dude who owns the gloves because he's so damn healthy. But it hit me hard because I was, in bankruptcy, single mom, trying to get my practice off the ground. So you see that we have to stop blaming the bugs and start looking at ourselves as the host and figure out why are we getting infected. Same thing with, viruses, et cetera. So I will leave it at that. So ringworm, very common. Antifungals work great on that. It can move all over the body. If your whole body gets covered in ringworm, you definitely have an immune system problem. And I would work with a good naturopathic doctor or functional medicine doctor to get that improved. Tinea versicolor is another common fungal infection, and it's where little splotches of white will show up, where it wreaks havoc on the melanocytes and they lose the ability to pigment. And that can also spread. Usually it stays contained in healthy people. All of these things stay contained in healthy people. Candida is common. Again, that would be gut driven. I've seen Candida mostly in the vaginal and buttocks area. I've seen it in the armpits. I've seen it actually around the mouth. Thrush is another example. That's a mouth fungal infection. All of these are in generally people who are stressed out or immunocompromised or have been drinking too much, or little kids who are not eating the right foods. My daughter had a kind of a chronic diaper rash thing with Candida, and she was eating formula. We had to switch at one point because of my breast milk production, and we put her on formula, and boom, Candida rash. That was clearly coming from a disbalanced flora. Once we started balancing the flora in her gut, her Candida cleared up. Yeah, we used some topicals on there, but it really was about getting her diet dialed in and getting the right nutrients in her and the right probiotics, and things cleared up. So remember, especially with fungus, we're talking about these are being driven by poor diet and metabolic dysfunction. I've seen them in super healthy people too, but generally they were under severe stress. If that doesn't work, this is when I start thinking about an immuno-driven rash. And this is where hydrocortisone actually works. An immune-driven rash is a rash coming from a systemic cause and your immune system's freaking out and presenting itself on the skin. An example that's super common would be eczema, or also known as atopic dermatitis. Seborrheic dermatitis is fungal. So cradle cap, dandruff on the scalp, that is actually seborrheic dermatitis, and that is more of a fungal issue. But atopic dermatitis and eczema is an immune-driven issue. It's actually autoimmune, and nobody wants to hear that. But if you have eczema, you have autoimmune disease, plain and simple. It normally occurs on the flexor surfaces of the body, like the knees and elbows. So the outside of the joint is the inside of the joint, like the elbow pit or the knee pit. That is the flexor surfaces. That's where you flex the joint. And that is really, really common, and it's autoimmune disease. Another common rash that humans are dealing with is psoriasis. Psoriasis is also autoimmune. It's less common than eczema or atopic dermatitis. It is definitely autoimmune. It most often will lead itself down the path eventually to psoriatic arthritis, which is a terrible, terrible condition to have, and I wouldn't wish it upon anyone, but that is kind of the path that people can look forward to if they don't get their immune system in check and they don't get their autoimmune disease handled. And go back and listen to my last episode. I talk a lot about autoimmune disease, and I've talked about it a lot on this podcast and on my Instagram and in my email list. I also just did an entire blog post on autoimmune disease and its relationship to the current situation. So go ahead and listen to that as well over on my blog. I'll link it all here. So autoimmune disease presents itself, interestingly, oftentimes through the skin, and so do other immune-driven responses. Hormonal imbalances and hormonal issues will present themselves this way as well. And I'll get a little deeper here. So talked about eczema, talked about psoriasis. Psoriasis is on the extensor surfaces. So that's the outside of the elbow or knee. And you've probably seen that. Those are more well delineated kind of silvery white scales that will show up on the elbows, knees, and scalp. And that's psoriasis. Sometimes you'll get pitting in the fingernails. And again, you can look forward to this presenting as psoriatic arthritis down the line for many people who have psoriasis. So get that shit under control. I've seen all of these rashes get much better when we take out refined carbohydrates, refined sugars, and put somebody on a more carnivore type diet. And so that's why I'm a big fan of eating a meat-based diet. I have a coupon code I'm going to share with you in the show notes for Regenerative Pastures, which is a company I work with who sell some of the best beef and meat that I have ever tried. And so I'll share that with you as well here. I love Regenerative Pastures. I love following a meat-based diet, and I really love how well it cleans up skin conditions. People's skin conditions of all sorts, acne, chronic immune-driven, even chronic infections that just won't clear, and people are applying creams all the time. We cannot keep applying creams. Creams are not the answer. Creams are Band-Aids. I vote we use them, and I definitely do myself to kind of keep things calmed down when necessary, but we don't want to rely on creams, and we certainly don't want to be one of those people who lives off of hydrocortisone cream, because hydrocortisone cream will ultimately thin the skin and make it more susceptible to infection, and it makes it look really bad, and it makes it quicker to bleed. And honestly, I think that the possibility of what it does to the skin over time could potentially lead to more propensity towards skin cancer. I mean, that's just a speculation, but not a fan of lifelong hydrocortisone cream. And what happens there is the skin gets so used to it that when you remove the hydrocortisone cream, you get a rebound response from the immune system, and it freaks out, and you get, boom, the eczema comes back, boom, the psoriasis comes back. So the answer is truly, it lies in your diet. And also sometimes and that will often do it. Often switching to a more carnivore type diet will clear it. If that doesn't work, that's when we bring in the hormonal testing. We look at things like thyroid and sex hormones, and obviously some advanced gut testing might be in order. But man, even in little toddlers, I'm not advising this. This is friends of mine who have toddlers who've gone carnivore under their doctor's direction, and boom, all of this head to toe eczema these little babies are suffering with go away. So that's that. I'm not prevention, treatment, or cure, just giving you some ideas and what I've seen clinically. Okay, so what about the rashes of the trunk versus the limbs? I talked a little bit about eczema and psoriasis, which most notably present on the limbs. As I said, psoriasis will sometimes show up on the scalp. Eczema can show up anywhere. And eczema can be confusing because you get this itchy red rash, and it might be because you changed laundry detergent. So it's a topical aggravation, but remember, your immune system is responding to the topical aggravation. So we can't blame the laundry detergent. Yes, get something that's less irritating for sure, of course, with no colors or chemicals or scents or anything. I use Total Hippie laundry detergent, and I encourage you to as well, because gosh, I mean, when you're using chemical-laden scented laundry detergent and it's all over your clothes, I mean, you're wearing that all day and it's just absorbing into your skin. I mean, that's a complete shit show for your hormones. But if that clears it, we still have to acknowledge that our immune system responded to the detergent and to the chemicals. And that tells me that it's a little bit extra, right? The immune system's being a little bit extra, and we want to get that under control. I don't want to tamp it down. I want to get it modulated. We don't want to talk about boosting an immune system or decreasing an immune system. We want a modulated immune system. And so when I see things on the trunk, I immediately go to either hormonal and or internal inflammatory immune driven. Usually it's immune driven. Straight up, I'll tell you the main culprits are gluten, parasites, and mold. And hormones, but usually comboed with some gluten, parasites, and mold. The easiest thing to do, because what you're going to do in a normal dermatologist office is they're going to take a little punch biopsy of the lesion, and that hurts. They numb you with something that stings, and then they take a punch biopsy, and then you have a little hole, and they either stitch it closed or they cauterize it, and it's got to heal, and then you have a scar. Or you could just stop eating gluten. You know, like that's usually how I advise my patients. Like, why don't you just go gluten-free for 3 weeks and see what happens? And 9 times out of 10, we get some really dramatic improvement. And particularly if you go gluten-free and go more carnivore leaning, we can really get the show on the road. So that's diagnostic, right? That tells us right there that our immune system was driving it, and it's probably due to what's going on with our gut to a big degree. So gluten, big one. And I'll talk more about that in just a sec, but I want to mention parasites and mold. I'm not going to get into parasites and mold. I know parasites and mold are a big topic these days. You see it all over the Instagram with the influencers. I totally believe they're there. Don't get me wrong. And you've heard me say this before. I do think that there is a fine line, because in third world countries where we have a lot of parasitic infections, they live symbiotically with the host, and we see a decrease in autoimmune conditions in those countries. So I don't want everybody to just jump on the let's deworm everybody bandwagon. I get that these worms can cause problems. I get that things can shift to a pathological state for the host. So obviously listen to your doctors and listen to your healthcare practitioners that you are under the guidance of. But jumping on the let's deworm everybody bandwagon and doing some kind of cleanse that you saw on the internet, just be careful, because if you're not symptomatic, it might be actually helping modulate your immune system. And I want you to look into that. If you don't believe me or it makes you raise an eyebrow, go look into it. Go look into Helminth therapy for autoimmune disease. Google that. They actually inject the eggs of these little worms into people's skin. And so long as the person's healthy, the eggs can be really immunomodulating, and these worms can be immunomodulating. I've seen it reverse Crohn's. I've seen it reverse all kinds of things. And so I'll leave that for you. I just wanted to plant that seed. But parasites can be a big driver. And boy, I have had some parasitic infections that have caused all kinds of problems in my body. So I am definitely one to go with what the healthcare practitioner that you're seeing suggests for you. Of course, don't not clear them if you need to clear them. And then mold and fungus are big ones. So mold, living in a moldy environment, living around mold, those people just sort of have chronic skin conditions, whether it's acne or seborrheic dermatitis of the scalp or candida or vaginal infections. Like just living in a moldy apartment or moldy house will make you have all the moldy skin conditions as well. And it really, really sucks. So that's a big one. And again, I'm not a topic for this podcast, but you can do your own independent research. And I'm going to have my friend, Dr. Jill Krista, who you may have heard of. She is a naturopathic physician who is a mold expert. And I'm going to get her on the show soon enough so we can talk all mold all day. We'll get there. And I will get some parasite talks on here too. So hang tight. Okay, so we're talking about lesions of the trunk and the body. And I definitely always go to gluten first as a causative agent. I'll tell you a couple types. Don't worry about this. It's not so much a derm lesson as I just want to share this with you. A common one is called dermatitis herpetiformis, AKA the gluten or celiac rash. I mean, that's literally in quotations what it's nicknamed, the gluten or celiac rash. These are itchy bumps and blisters on the extensor surfaces. They can be burning, fluid-filled bumps. Sometimes you'll see, I think its close cousin is you'll see it on the fingers in between the folds. I've seen that as well. And it can be diagnosed by biopsy, of course, like I mentioned, but just cutting gluten to see if it goes away. It looks a lot like eczema. And again, if someone has eczema, I assume autoimmune, and I say get off gluten anyway. So there you go. There's my advice. The other extensor surface, though, rash, remember, was psoriasis, not eczema. So you see where this gets confusing. And they can all look very similar. Both eczema and psoriasis have links to celiac and non-celiac gluten sensitivity, by the way. And there's a particular eczema called nummular eczema, which is these well-defined discoid lesions. So they're like little circular discoid lesions. They look a lot like ringworm. It's chronic and it's itchy. It often starts on the trunk, but also the arms and the legs. It sometimes is on the scalp. Ringworm, I'll tell you though, when you start putting an antifungal on ringworm, it heals from the center out. Nummular eczema will heal from the out in. And it won't respond to an antifungal because it's being driven by gluten and it's being driven by your immune system. So different beasts. But anyway, remember my antifungal cream first attempt advice because it might be ringworm. And I just saw a case of ringworm on a child's trunk that looked, in my head, I would have guessed nummular eczema, but by the picture, it was not reddened and it was not raised. And so I went with ringworm because of her age. And sure enough, that's what it turned out to be. Another common one is called pityriasis rosea, and the name literally means fine pink scale. This is fairly common more in younger people, whereas nummular eczema you're going to see in an older age group. Both of them I would get off gluten. I think that gluten can be a huge driver for both of these, and we see that in the literature as well. Usually it starts with what's called a Herald patch on the trunk, which is a discoid lesion that looks exactly like nummular eczema, and sometimes it looks like ringworm. So you see again, they all get mishmashy. But it can be caused from infectious agents. It can be caused from pharmaceuticals. It can be caused from immunizations. And so it's that immune system driven presentation of a skin lesion. So anytime you see something on the trunk or the scalp, I want you to think potentially that there's immune driven source here, root cause, and I want you to consider gluten as a culprit. Now, I'll give you another hint. Anytime you see something bilateral, I want you to think systemic immune driven. So both eyes, both hands, both shins, both feet. Yes, it could be your gut. It could be gluten. It could be hormones. It could be, whatever. It also could be parasites and mold. But whenever you've got both sides involved, I want you to think some kind of systemic cause. Some kind of systemic immune-driven response. So this gal in Mexico had rashes around her eyes, both eyes. My immediate thought, and I have some spidey sense around diagnosing. It's my gift and my curse, but I can look at somebody and just kind of know what's happening. And I looked at her and I said, I think it's immune-driven and it's from parasites. That was my immediate hit from the universe. And I can back it up with all of my clinical thinking skills as well. And she wanted to believe that it might be infectious from swimming in the ocean because the beach at Sayulita is disgusting. And sure, it could have been that too. So we went through the whole gamut. But I do think that we have to consider an immune-driven response and what is the root cause of that immune-driven response. That's how I want you guys thinking when you've got rashes, especially chronic rashes. So anytime you see bilateral, think systemic immune-driven. I'm talking both eyes, both hands, both shins, both feet, etc. Sometimes it can be bacterial and fungal at the same time and immune-driven along with that. And what do I mean by that? Say you have an immune-driven rash and it's itchy and it's bugging you and you start scratching it. Well, the skin can become compromised and infected by any variety of agents. So you might have a fungal or bacterial infection that infects the compromised skin because you broke it open by scratching the heck out of it. So that's where that happens. And that really can get things messed up. And when they start biopsying that, all kinds of reasons can come back and all kinds of diagnoses. But I'm telling you, infections of the skin from bacteria and fungus don't happen as much in healthy skin. And then there's hormonal issues. I'll give you a few examples of this. Some of you ladies suffer from melasma, which is a darkening of the skin, and it can happen most notably on the face, usually on the upper lip. I've had it. I had it after the birth of my daughter. It is always, and I've always treated it this way, it is a metabolic issue. It's a blood sugar handling issue combined with an estrogen dominance, always. And you'll see it actually if you pay attention to it. If you go out in the sun, and it gets darker with the sun. If you go out in the sun when you are close, when you're on your cycle where your estrogen is elevated, there's a couple parts of your cycle, right, where hormones dip, and I'm not going to give you a cycle lesson here, but just pay attention to when during the month it is in your cycle. And you will probably see that you're having either a tremendous dip in progesterone, which is going to make you by default estrogen dominant, or you're having a spike in estrogen at that period of the month. It's a hormonal imbalance issue and a blood sugar imbalance issue, a metabolic issue. You can't balance your hormones unless you balance your metabolism. I'm going to say that again. I am so tired of listening to hormone experts talk all about hormonal balancing. And they mention, some of them, like, I got to give Dr. Carrie Jones props. She's always banging this drum. Like, she really does double down on this. But some of them are just like, oh, just take this supplement. Everything will be fine. It's like, no, your metabolic health is out of whack. So your hormones will always be out of whack so long as your metabolic health is out of whack. So it's really important that cause is addressed, that root cause, which I think is the root cause for everything. Pretty much. I mean, if you really want to go back, if you want to do a root cause game and just be like, okay, well, what caused that? What caused that? What came before that? At the core of it, it's all being driven by inflammation coming from metabolic dysfunction. And I have a great program coming out here very shortly that you guys are going to be blown away with. I am so excited, and you guys will hear about it first. My listeners, the people on my email list, you guys are going to get first access. So anyway, hormonal imbalances. Another common hormonal issue is, say, for example, hypothyroidism. Hypothyroidism can lead to chronic hives. There's a skin condition for you. Chronic hypothyroidism can lead to something called pretibial edema, which is a myxedematous swelling of the shin. You may not notice swelling, but you may notice that your skin there on both sides is compromised. You might notice that it itches or that it's bumpy. That's actually where I get a little eczema rash. It's not eczema necessarily. It's just a little kind of, who knows what it is. It's like a little red prickly rash, and it's on my shins, and they start itching like crazy. That tells me I either ate something with gluten in it, or maybe my metabolism isn't as dialed in as I want. And this is fleeting. So whenever I've ran labs, my metabolism looks epic, but it can be transient, right? You can have transient insulin resistance in the tissues from stress or from lack of sleep for a few days. It can be all kinds of reasons. So it's not necessarily like, oh my gosh, your whole lifestyle screwed up. It just might be a transient thing. It might be from where you are in your cycle of your period. All kinds of reasons. And so this pretibial myxedema can cause a classic presentation of a rash on the shins. Now, that rash, I've seen it multiple times on patients, and every single time it looked different. Mine did not look like theirs, but I will tell you, often the common thing I'll hear is and I had this too, is it kind of looks like fishy skin at first. That's the first glimmer harbinger that something's coming. You get a little bit of a fishy skin, like scaly almost look of your shins, and you apply lotion and it kind of goes away, but you're like, and then it starts to itch, and then it can go from there. I've seen chronic fungal infections there. And think about this logically. When you're low thyroid, and you have myxedema there, you're having a blood flow issue. And so if you scratch it, you're going to get a fungal infection, and it's going to be more likely to take and hold because you don't have great blood supply and you don't have great metabolic cellular turnover, and the skin is 7 layers deep. It needs to turn over regularly. A lot of skin issues are low thyroid. Acne is a great example. If that skin cannot express in a normal, healthy way because that skin isn't turning over metabolically as it should, you're going to be kind of in this perpetual cycle of acne and problems. And so it's not just one thing, you guys. That's what I really want to drive home here. If you need thyroid hormone or some kind of thyroid support, then that's really important to have addressed. Again, this is why I encourage you to check in with your health practitioner. And if you have a health practitioner who doesn't know this stuff, find someone who does. And you can find those people in the naturopathic profession, although we're not all the same and we don't all think the same. You can find that in the functional medicine world. Again, not all the same, not all think the same. A large portion of both of those groups have completely drank the Kool-Aid on this whole narrative. So I don't know what to tell you there, but they usually can handle these types of things. Okay, so we've covered some hormonal issues, and one of them being thyroid, one of them being sex hormones like estrogen. Testosterone can have issues. I've seen issues with men with low testosterone. I've seen all varieties of skin issues. So again, we need the balance of hormones in our system. And in every single one of these cases, these patients all had underlying metabolic issues. So it didn't matter how many hormones I throw at it or how much cream we put on it. If we don't address the lack of muscle mass, the protuberant belly, and the metabolic dysfunction that's really driving the whole thing, we just kind of go round and round in circles. If the sun sets you off, I want you to think hormones and immune system. However, that said, We have good studies, good, big, longitudinal, double-blind placebo studies showing that regular sunbathing, and this was a study out of Sweden, regular sunbathing has profound benefits on overall health and vitality and keeps people alive longer. And autoimmune conditions can really be impacted positively by the sun. However, if you're not in good health, if you're eating a lot of seed oils, if you're eating a lot of refined carbohydrates, if your metabolism is all out of whack and therefore your hormones are out of whack, and you go out in the sun and say you bake yourself out there, you spend a lot of time out there, and this has happened to me when I was not in the best health of my life, postpartum, you really can cause a lot of issues and it might flare you. So I've seen patients come back from tropical vacations, and I don't know if it's because they were drinking sugary drinks while they were there, or they were eating crappy food, or they weren't eating how they're used to eating, or they picked up a bug or a parasite in their gut that set things off. But I've seen them come home and flare from, quote unquote, what their dermatologist or their primary care said was too much sun. Sun is not meant to be baked in. Sun is meant to be dabbled in. Sun showers, 10, 15, 20 minutes in the sun every single day, really, really good for you. Building up just a slow, nice, easy coloration to your skin can have all kinds of profound health impacts that are positive. Going out and cooking yourself in the sun or getting too much sun in the day can cause problems. I just recently was in Mexico. I did great the whole time. I wasn't burning. I was doing awesome. People ask if I might use a little bit. I'm going to do a whole episode on the sun, so I don't want to get too far into it here. But the second to last day I was there, I ended up on the water and I went out at the wrong time. It was not a good time to be out there. It was midday sun, even though I put sunblock on, and I think the sunblock probably aggravated my skin. And the whole rest of the day was cloudy and overcast. And that's a pretty dangerous place to be because you don't think you're getting burned. And I know better. And I thought I was staying under umbrellas the whole day, but I guess I got too much of that cloudy exposure. And then I was out on the water getting, it was reflecting off the water, and my face got pretty red. Now, it barely peeled, but I got a terrible, terrible cold sore outbreak when I came home. And so I think that, we got to look at all of this and say, Tina spent too many hours out in the sun one day. Even though I was tan and healthy and taking all the supplements, which again, I'll talk about all this in my upcoming podcast episode, but we don't want to bake the crap out of ourselves in the sun. Americans are so weird. They will eat a bunch of crappy food that actually, if you eat a lot of seed oils and drink a lot of alcohol, that actually potentiates skin cancer development. And then they spray themselves with a bunch of toxic sunblock with chemicals in it that actually creates skin cancer. And then they bake all day out in the sun. And I'm like, I'm more of a find an umbrella or a tree and be like shade, sun, shade, sun, shade, sun. That's how I do sun. I do sun really smart. I grew up in the age before there was sunblock. The first time I put sunblock on myself as a young person, it had PABA in it and I got a terrible rash. So I don't love sunblock, but I use it when I need to. And I'll share this in a future episode, but I do like the shade, sun thing. I'm telling you this because it's really good for rashes. It really, really helps dry up and dry out rashes, especially fungal rashes. So if you have any kind of fungal infection, get out in the sun and let the sun dry it up. If you have any kind of bacterial infection, the sun should help. If the sun sets you off, something's wrong inside your body. Something systemically is going on. And that's worth working with a naturopathic or functional medicine doctor. Viruses can invoke transient rashes, by the way. A lot of people don't realize that, but there is sometimes that's the clue that you're sick. I've seen that. I'm sure many of you have experienced this. You get a weird rash. You're like, what the heck is this? I often will see it on my chest. I'll get a weird prickly heat rash on my chest. And next thing I know, I'm sick. So take that for what it's worth. But viruses can set off rashes as well, because again, it's stoking your immune system. And let me talk about herpes for a minute, because I just had a cold sore. The sun can really set that off, as I've just explained. But also at the same time, having adequate sun exposure and good vitamin D levels and all the other wonderful benefits that come from the sun can keep viruses at bay. So it's moderation and doing it intelligently. We don't want to go out and bake ourselves uncovered for hours, but also we don't want to avoid the sun. Impetigo, I want to talk about this for a minute. Impetigo is commonly associated with children, and adults don't think they can get it. And the reason I'm talking about it is because A, it's a rash, and B, it often gets misdiagnosed in adults as herpes. And I've seen this happen with even super smart doctors. But impetigo often will show up around the nose, the whole, the nasal passages, and it will show up around the lips. And so, yeah, it could easily be confused with a herpetic outbreak, but it's got a yellow honey colored crust and it burns. It is not a fun thing to have. It's burny, it's crusty and gross. And I have had too many patients walk in my door with it after having it for weeks, and their primary care physicians diagnosing them with a herpetic outbreak and putting them on antivirals like Valtrex or something. And I'm like, no, it's just a bacterial infection. We call it impetigo. It's bacterial caused, and a simple over-the-counter or prescription antibacterial ointment will clear it up. But here's the big but. I'm going to point my finger at metabolic health again. Every single one of those patients had a metabolic dysfunction. Did they get it from kids? Some of them, yes, they picked it up from their children. Some of them picked it up just being out in the world. All of them drank too much and too frequently, I should say, and they all had bellies. They all had metabolic dysfunction. So again, a metabolically unsound body will invite infectious agents more readily than otherwise. I talked about parasites and mold again, but I don't want to discount it. That can be a driver, and that's where you're going to get those chronic rashes, sometimes bilateral. So what can we do? I've already mentioned get your metabolic health in order. I've got a program coming soon for you. I'm so excited for you to listen or check it out. I have an episode all about metabolic health on this podcast. I'll link. I want you to listen to that as well. And then I want to talk a little bit about supplements. Creams and supplements are not the solution. They're just adjunctive. So sometimes we need topicals in the form of a drug cream, or we use natural creams. Those can be helpful, of course. I love my herbal ointments. I love my over-the-counter prescription ointments. They have, gotten me, they help me in a pinch. But we don't want to keep putting them on because really they're just Band-Aids. Supplements are not the solution. They're just an adjunctive helper, and they can be really, really helpful. And I think of things like collagen induction, collagen integrity, skin mantle integrity. Those are the things that we want to focus on when we're talking about keeping rashes at bay or helping heal up the skin, right? We want nutrients that are going to help with healthy skin production. And so some of those that I have inside my store, I'd like to offer you a discount on if you buy them as a bundle. I've got a new product out called Beauty in a Bottle. It's such an awesome product. It's an advanced collagen supplement. It's really marketed as a hair, skin, and nails nutrient, but it does great things for your joints as well because of this advanced collagen ingredient inside. So Beauty in a Bottle, love it. I love it for lots of reasons. Makes my skin nicer, makes my joints happier. It's a good one. When I think of collagen production, I think of vitamin C and zinc. Those are the two main things that I would give patients when I wanted to induce collagen for their joints. But it's the same for our skin. And vitamin C and zinc don't go out of style, right? Those are just two wonderful supplements to have around. I've got two more things. I have a product called Daily Collagen. Daily Collagen is a wonderful collagen product. My husband, it's so funny. Every time, you've heard me say this, every time he takes it, or he goes off of it, I should say, for a short period of time, like we were just on vacation and he wasn't using it, and he goes back on it and he says the same thing. He goes, this stuff really helps my knees so much and I don't notice it until I go off of it. And he's not wrong. It's a wonderful collagen product. It's a scientifically studied product, and it's got good data backing it. It's not just your average run-of-the-mill collagen. I love it. It's in my line. It's called Daily Collagen. And then, of course, omega-3s. Omega-3s are going to be your skin mantle protector. And we have too many omega-6s in our diet. We know this. This is just kind of how it goes. It's the modern world we live in. People are eating too many seed oils. They're eating too many omega-6s. We can try to avoid them like the plague, but they're literally everywhere. So if you're eating out or you're eating any kind of processed food, you're probably getting omega-6s in your body. So we want to get enough healthy omega-3s to balance that out. How your skin mantle fatty acid layer, that's what it is, handles things really determines whether or not you are more prone to infections or not. So this is why I'm not a big proponent of soap. I'm not a big proponent of scrubbing your skin or applying lots of acids to the skin. I'm a big proponent of keeping the skin mantle healthy. And so my Ultra Omega OK product is a awesome fish oil supplement. It is a monoglyceride form. It's one of the few on the market in that form, highly absorbable. It's 3 times more absorbable than your average brand and doesn't give you any fishy burps. So you can dose 1 capsule will give you what 3 capsules from the competitor will give you. So if you buy those as a bundle, and use the code DERM20. I'll give you 20% off everything in that bundle when you buy it together. I know it sounds like a lot of products, but trust me, if you suffer from chronic skin issues, you're going to want help on your side. And I want you to also consider looking into your dietary habits, lifting weights, getting enough sleep, doing all the things that we need to do to get our metabolic health in order. Remember, as always, optimize your terrain first so the bugs can't get you as well. Dial in your diet and metabolism, get some sun on your skin, again in moderation, and take really good care of your body so that your immune system doesn't freak out all the time. And your skin rashes will start to calm down and you'll start to see improvement overall. Your skin is telling you something if it's rashing out. And we have to listen to that call, because if it's happening on your skin, it's happening throughout your body as well. Your brain, your vascular system, your heart, all of those organ systems are being impacted as well. I hope this was helpful. Go back and listen to it and take notes if you need to, and I'll talk to you on the flip side. As always, if you like this podcast, it would mean the world to me if you would rate, review, and subscribe on your favorite podcast player. I'm partial to Apple Podcasts. That's where I'm trying to rank, and I would love if you would head over there, leave me a rating and a review, and subscribe so that each week when I release an episode, it drops right into your inbox and your email box. Thank you so much for being on my team. Thanks for listening to the Dr. Tina Show. Please be sure to follow me on Instagram at Dr. Tina, that's DRTYNA, and Dr. Tina 2.0, as well as visit my website at drtina.com. This is a Resonant Media production, produced by Drake Peterson and mixed by Chris McCone. The theme song is by John the Guilt. As always, you can email the show at podcast@drtina.com, and if you like this episode, please rate, review, and subscribe on your favorite podcast app. See you next week. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.